Thank you, Mark. Tonight now in Medical Rounds, we are previewing a special episode of Advancing Medicine on the topic of men's health. It's called Taking Charge, Men and Health, and it airs tomorrow night at 7:30 right here on Channel 3. But first, joining us live is Dr. Joseph Wagner, a urologist and director of the robotic surgery program at Hartford Hospital and one of the doctors featured in the program tomorrow night. Thank you so much for giving us a preview tonight, Dr. Wagner. Good to see you.
Nice to see you. Thank you for having me.
Well, we're taking a closer look, as you know, at men's health, and we all know that men do not necessarily take charge when it comes to their health, especially the PSA test. How important is this test, and why should men really try to be more proactive?
Well, PSA is a blood test that we use to look for prostate cancer. And right now, the medical community recommends shared decision making, meaning the patients should talk to their doctors, go over the pros and cons of the testing, and then decide if it's right for them. It's very important that these discussions occur, and it's particularly important for men at high risk for prostate cancer. And those are African American men or men with a family history.
And being proactive is helpful because it will spot something before it becomes a major problem?
Absolutely.
All right, now we profiled a new high-tech imaging machine called the MRI ultrasound fusion. This was really interesting. Tell us how it works.
Sure, we're very excited to have this technology. And to do an MRI fusion, the man first undergoes an MRI, and then we get very good pictures of the prostate and mark any areas that might be suspicious for prostate cancer. They then undergo an ultrasound, and the MRI pictures are downloaded into the ultrasound machine and then fused on top of the ultrasound pictures. So as we move the probe, looking at the prostate with ultrasound, we can guide the needles into those suspicious areas. So you're really now getting the best of both worlds.
And so are you performing fewer needle biopsies as a result?
That's the goal. Right now, we're mainly recommending this technology for men who have been diagnosed with prostate cancer and are interested in active surveillance to try to find any more aggressive cancer that might be hiding somewhere in the prostate. And also for men who've already had biopsies and whom we're suspicious might have cancer. Down the road, we might use MRI to image the prostate, get more information, and avoid the biopsies in their entirety.
Good to hear. All right, Dr. Joseph Wagner, we thank you so much for taking the time to talk to us tonight. Prostate cancer is just one of the topics that we'll be discussing tomorrow night. We'll also profile a new procedure for heart disease and surgical options for weight loss. If your man is someone who does not like to go to the doctor, this would be a great opportunity to get him to sit down and try to watch the program and see how important it is to take charge of his health. All right, once again, it's Advancing Medicine tomorrow night beginning at 7:30 right here on Channel 3. In the meantime, if you have a question for Dr. Wagner, very knowledgeable, he's available on our web chat right now. All you have to do is just go to WFSB.com.